Hello.
Okay. Hi, Khatim.
Yep.
Hi, Dr.
You can
Newman.
hear it. Hi, how are you?
Hi, how are you? It's early morning there, isn't it?
Not that early, but that's like close to noon for you. So I live on Singapore time.
So we
Okay.
are so thankful that you're able to make it on this Zoom meeting, all organized by Ellen. Thank you so much, Ellen. Okay. Hello everyone. Thanks for tuning in to BMSG's first online video program here on social media. Welcome to Ask Dr. Jack Newman, Breastfeeding in New Mamas, with the focus today being jaundice and supplementation. My name is Khatim Hamidon, and I have my friend here, Ellen Nepilly, as co-hosts for this show. We're both volunteer counselors and exco members at the Breastfeeding Mother Support Group Singapore, or the BMSG. So our objective for this session is to empower parents with information that you can make informed decisions backed with evidence when it comes to caring for your babies. So who is Dr. Newman? So Dr. Newman is a breastfeeding expert and activist and a pediatrician. And he's had more than 38 years of experience helping mamas and babies with breastfeeding. And that's even older than me, and has written a few books on breastfeeding as well. At BMSG, his resources are highly regarded by our counselors. So we have Dr. Newman here all the way from Toronto, Canada, answering the questions that you've sent in. And there are a lot of questions. So for the sake of better clarity and time management, we may be focusing mainly on jaundice for now. So thanks for being with us, Dr. Newman. We're so grateful for you to join us so early in the morning at 7:30 in Toronto, right? So how are you?
Right. I'm well, and how are you?
Great. I'm so excited to be actually talking with you. So you're like,
Oh,
I'm fangirling now.
too.
So anyway, so
Okay.
Dr. Newman has actually been to Singapore twice, isn't that right?
That's right. Yep.
Yeah.
Many
So
years ago.
So I actually have a friend who related to me a lecture about 20 years ago, organized by the BMSG and held at the KK Women's and Children's Hospital when she was pregnant for the first time. So it really made an impact on her to choose breastfeeding. And she asked me to actually thank you on her behalf. So thank you, Dr.
All right.
Newman.
Thank you.
Yeah.
Thank you.
So let's start with the basics. Let's get to it. So,
Okay. So
yeah, our topic is jaundice, right?
right.
So over to you. So what's jaundice?
Well, jaundice is what we call an elevation, although we can discuss that too, of a compound called bilirubin in the baby's blood that gives the skin a yellow color. Now, I want to start with a different approach than is usually used when we discuss jaundice, and that is that bilirubin is the last product when hemoglobin is broken down in the baby's blood because it comes from red blood cells, and red blood cells have a limited lifespan. It's shorter in babies, in newborn babies, than it is in adults, but these red blood cells die all the time, and compounds are released, including something called heme, biliverdin, and bilirubin. Now, I don't want to get too technical about this, but the fact of the matter is that to get rid of the heme, which the body does want to get rid of, the body extracts an iron molecule from the heme and then wants to get rid of the heme because the heme is toxic. So the heme is broken down to something called biliverdin, and then the biliverdin is changed to bilirubin. But the body doesn't have to make bilirubin. Biliverdin is just as good a compound to get rid of the breakdown product of heme as bilirubin. So why on earth does the body spend an incredible amount of energy to get rid of this biliverdin to make bilirubin? And the answer is that bilirubin is good for you. Bilirubin is an antioxidant. Bilirubin gets rid of organic free radicals that can damage cells. Bilirubin protects against recent article against beta hemolytic strep. Group B strep is what I mean, sorry. That often causes meningitis in newborn babies. So bilirubin actually is not bad for you. And we have to discuss, as we go along here, bilirubin in the first few days after birth, and bilirubin that occurs weeks and months after the baby's elevated bilirubin that occurs weeks and months after the baby is born, which we call breast milk jaundice, but I would call normal and good for you. So I'm not sure if I can just keep talking or you're going to ask me some questions here, but we need to separate those two types of situations where the baby might have elevated, or what we call elevated bilirubin. So we have the question of, first of all, bilirubin is good for you. What's wrong with having an elevated bilirubin in the first few days after life, after the baby is born?
Yeah, I think these two are often getting mixed up, and in the healthcare setting, and also for parents when they hear that the baby has jaundice, many times they're really quite scared and they think it's really something bad. So it would be really good to know the difference and when to know when it's the one that is rather
okay, so when it's normal and when it's not normal.
Okay, so in the first few days, babies who have higher than average bilirubins are often forced to take formula to lower the bilirubin. And we know that very high levels of bilirubin are associated with things not going well in the first few days. The most common cause is the fact that the baby's not breastfeeding well. So we have this situation where the baby is not breastfeeding well, where the baby is perhaps dehydrated a bit, and this is not good. And so we saw this situation when the babies were having hemolysis, right? Secondary to antibodies in the baby's blood because of the mother's RH incompatibility. So these babies got very, very sick, some of them, and we used to do exchange transfusions to get rid of the bilirubin, except that we weren't really trying to get rid of the bilirubin. We were trying to rehydrate these babies. We were trying to get them in a good state. And what we lost track of is that the bilirubin was not the real problem. The real problem was the dehydration, the acidosis, that's acid in the blood, and this is what caused the breakdown of the blood-brain barrier and resulted in bilirubin going into the brain. And so when these babies died, and some of them did die, they did autopsies and they found that the basal ganglia of the brain were stained with bilirubin. And so bilirubin was blamed for the whole situation, but the bilirubin wasn't the real problem. The real problem was the acidosis, the heart failure that these babies often had, the dehydration, which allowed the bilirubin to go into the brain. So bilirubin, in a sense, was a innocent bystander and was blamed for all the problems that these babies ended up with. But the real problem was that the babies were dehydrated, acidotic, and so forth. And this is what happens when babies are not breastfeeding well in our new modern hospitals, where RH incompatibility is really uncommon. So the real problem is not bilirubin. The real problem is that the babies are not breastfeeding well. And so the answer to babies not breastfeeding well in the first few days of life is not, oh, we better give the baby formula. The answer is, let's fix the breastfeeding so that the baby's bilirubin comes down to a more normal level. That's the real issue. With regard to, and this can be done in many ways. I mean, we need to help the baby latch on properly. We need the baby to get milk from the breast. We may even have to supplement the baby, but the baby should still be at the breast. And we recommend using a lactation aid at the breast to give the baby the supplement. And of course, the best supplement is mother's own breast milk. The second best is bank breast milk. And only if these two are not available, then we give the baby formula. So this is how we deal with the bilirubin in the first few days. Fix the breastfeeding. Now, there is something called breast milk jaundice, which I call normal. Breast milk jaundice is present often 2, 3, 4, 5, 6 weeks after the baby was born, sometimes even into the 3rd month of life. And this is normal. If the baby is breastfeeding exclusively, if the baby is, in obvious good health, if the baby is gaining weight well, then this is good for the baby. And we have an example of how bilirubin can be good for you in something called Gilbert syndrome. Gilbert syndrome is an abnormality of an enzyme that results in normal people having higher than average bilirubins throughout their life. When they get sick with a cold or something, the bilirubin goes up, giving the impression again that bilirubin helps to protect. The other thing is that these people have a much lower rate of atherosclerosis than people who don't have the higher bilirubin. And again, this gives us the impression that bilirubin is good for you. It's an antioxidant. It protects the heart. We know that the heart, atherosclerosis, is a inflammatory disease now, and the higher bilirubin is good for you. So if the baby is, with regard to breast milk jaundice, if the baby is breastfeeding beautifully, breastfeeding exclusively, the baby is obviously in good health and gaining weight well, then this so-called breast milk jaundice is not abnormal, and it's actually good for you. The only other thing I should mention is that it's possible some babies will have something called, will have liver disease due to the bile duct from the gut, from the liver to the gut is blocked. And this causes a different type of jaundice, which results in the urine being brownish because the bilirubin can't get out of the liver normally. So it regurgitates into the blood and comes out in the urine. So these babies have a large liver and a large spleen, and they need some sort of intervention. But this is not the sort of jaundice that I was just talking about, where the baby is obviously in good health and gaining weight well. So we need to separate this problem with the bile ducts and the liver, the bile ducts, from what we can call normal breast milk jaundice. So I've said my bit, and we can, if you have questions about this particular issue, if you have other questions, if I'm not clear about certain things, then let's go to the questions.
Okay, so you mentioned just now that there's normal jaundice and there's abnormal jaundice. So we were talking about reducing jaundice as well. So maybe because if the mothers are able to breastfeed their children beautifully, then there's going to be normal jaundice, even though it may be prolonged. Am I right to say that? Up to 6 weeks, right?
No, sometimes into the 3rd month of life.
Oh, wow.
Even longer. Yeah, yes. But remember that this is normal. Again, if all the conditions I mentioned are maintained, that the baby's otherwise in good health, that there's no evidence of liver disease, then there's nothing wrong here. And in fact, there's probably something right about this. So saying that 6 weeks of jaundice is okay, but 3 months is not, no, I don't agree. I think it's not uncommon. And it's particularly so in babies of East Asian background. It's more common in them than they are in, say, babies of European origin, or anybody but European origin. These babies have jaundice that's longer and higher than it is in babies of European origin.
So mothers, we do have some questions on, moms asking how long does jaundice last. So even if it's up to 3 months and baby's breastfeeding well, and even longer, so babies shouldn't worry so much. The moms shouldn't worry so much.
Yeah, the babies don't worry.
The babies just worry about boobs. So okay, so there's one more question with regards to so-called flushing jaundice down, because people here they may not understand the benefits of jaundice, as how you were saying. So there's like lots of things that they do to reduce this jaundice. So just now you mentioned that babies may need to be supplemented if they are overly dehydrated. So is it a must to always supplement on the formula if the mother says that, there's no milk coming in? Is it a must to supplement with formula, or can they be supplemented with water up to, I don't know, when they're much older?
I would not recommend supplementing with water, but I think that, again, the mothers may feel that their milk has not come in, but the milk is usually there. The problem is that the babies are not getting the milk. And it's often because we don't teach good latching on. If we don't show the mothers how to know the baby is actually getting milk from the breast, we just assume that there's no milk. I mean, this is a rumor that in the first few days, there's no milk. Of course there's milk. The milk started to be formed in the mother's breasts by about 16 weeks gestation, when the mother's only 16 weeks pregnant. And it's been collected for all this time. There is milk. And it just doesn't make sense that nature did not work this one out, that nature said, well, we're just going to keep babies on no food for the first 3 or 4 days of their life, and that's just too bad. No, that's not the way it works. But the thing is that babies don't get milk well if the baby's not latched on well. Now, this is particularly true when the amount of milk in the breast is not, a lot, as it isn't in the first few days. It's not a lot, but it's sufficient. So the babies have to latch on well. Once the milk comes in, babies don't have to latch on so well to get the milk, but mother may have pain, and in fact, the baby may not be getting enough milk, even if there is plenty of milk. This is one of those things that we all, there's not enough milk. But in fact, a lot of the problems of babies not getting enough milk is not because there isn't enough, but the baby not receiving it, because usually they're not latching on well. So I don't know if I've answered your question, but I think I did. I just kept talking.
I like the recommendation you make on one of your in one of your blog articles about starting hand expressing before birth to collect some colostrum for emergencies. I really like to tell that to my clients as well, if I have the chance to see them early, to start early and collect it in a syringe. Maybe you want to talk about a bit more about that. Do you like to recommend that to everyone, or only to?
Well, I'm not sure I would recommend it for everybody, but I think that where there's a situation where the mother, where the baby might be automatically supplemented after birth, I think that, of course, it's much better that the baby be supplemented with the mother's own milk. One of those situations is where the baby is particularly large at birth. They know this often before the baby's born, or where the mother has diabetes, either type 1 or type 2. And then in many places, automatically the baby gets formula. But I think that this is not such a good idea. And I think in these situations, let's get the mother to express her milk so that the baby does not get formula in the first few days, but gets her own saved colostrum or breast milk. And should we do this for everybody? Well, there are some hospitals where almost every baby is given formula because the milk is not in. Well, maybe in such a case, yes, all mothers delivering at that hospital should express their milk first before the baby is born, so that the baby can get breast milk and not formula.
I think it can be also quite empowering to learn how to hand express and see there's actually something coming out, because sometimes when moms start trying when baby's out and they're tired and stressed after because the baby needs the milk now, it can be much harder to figure it out how to do it. So
yeah, sure, absolutely.
I think there was one question where a mother asked, will it result in contractions when the mother's still pregnant? So is that true?
Well, there's no evidence for it, and many mothers breastfeed while they're pregnant, and there's no increased risk of the baby being born prematurely or there being a miscarriage. So I don't think, I mean, there is evidence to suggest that it's actually not true. This whole idea that if I express my milk, if I feed the baby while I'm pregnant, that the baby will be born early or will be born, or will not be born, will be lost. And I think there's just no such evidence. 15 to 25% of all pregnancies end in first trimester miscarriages. So, if the mother's not breastfeeding, say, well, it's one of those things, this can't be helped, that sort of thing. If the mother's breastfeeding, oh, it's because you're breastfeeding. You shouldn't have breastfed. It's all your fault.
Oh, okay. Thanks so much for that. So you were saying that jaundice can actually be beneficial. So is there a need for babies to be given phototherapy or have direct exposure to sunlight to so-called break down these bilirubin?
Well, I mean, it's in some cases phototherapy may be necessary because, but it really is not to be used just because the baby is jaundiced. I don't agree with that. I think that there is evidence, for example, that phototherapy actually may cause changes in the baby's cells that may be precursors to cancer. I mean, look, babies are under phototherapy sometimes for 2 or 3 or 4 days. We tell parents, oh, you're going outside with your child, put on the sunblock. And you're going out for 2 hours. Babies are under phototherapy continuously for 2 or 3 days sometimes. Shouldn't we be concerned about exposing the babies to ultraviolet?
Thank you for throwing this in. Yeah.
That's an insight that I've never really heard about spoken before. So that's something new for us. Then
there is a study there is a study that showed that there was DNA damage in the skin of these babies when they're under phototherapy.
So is there like a best practice? Like, when would you recommend phototherapy and when is that? Like, is there a limit? Like when the jaundice is at this level or that level?
Well,
that, this is a risk that you have to take anyway.
This is what's usually done. They have all sorts of graphs that say, well, the baby is so many hours old, the bilirubin is so high, but we're not really treating the correct problem in the most cases. Okay, so if the baby's hemolyzing, we can't really do that much about it, and so the baby may require phototherapy, and we use phototherapy to prevent exchange transfusions, which have their own risks as well. So the most important thing, in the vast majority of cases, we don't need to use phototherapy. In the vast majority of cases, we really just need to make sure that the baby is breastfeeding well and getting milk well. And I would say that in the majority of cases, even supplementing with formula is better than putting babies under phototherapy, because in those cases, they're often not breastfeeding because they're under the lights. And, they don't want to take the baby out from the light, so the mother can't breastfeed. And so, run into a vicious circle where breastfeeding does not work. I mean, a lot of the problems with breastfeeding are from the first few days and week after the baby's born. And if we don't get the breastfeeding started properly, then often problems continue.
I hear that quite a lot, that moms say breastfeeding was going very well, and then baby had to go under the jaundice lights, and then when baby came back, wouldn't latch anymore and things like that. So yeah, that's
well, if the breastfeeding was going well, then there was no need for phototherapy.
At least baby latched. So but yeah, phototherapy is quite often prescribed sometimes.
Right, but of course we're talking about now that the most common problem being the baby's not breastfeeding well, and that's why the bilirubin is elevated. So the important thing is to get the baby breastfeeding well. There are studies.
Oh, sorry.
I was just going to say, there are studies that bilirubins as high as 25 in the first few days have never caught. 25 is about 400 and something, 450 micromoles per liter. Is that the anyway? 25 or 400 and whatever have caused no problems for babies. There's no evidence that if the baby is otherwise well, that even elevated levels of bilirubin are dangerous for the baby.
We have a question here on a mom asking about RH blood type and breastfeeding. So she said that her doctor is, slating her to go, for her baby to go for the blood transfusion. Is it? So can you tell us more about that?
Well, if the baby needs an exchange transfusion, I presume that's what she means, then I still don't see why there is a problem with breastfeeding here. I mean, an exchange transfusion takes maybe an hour. There's no reason that just because of that, the baby should not be breastfeeding. On the contrary, the baby should be breastfeeding. Exchange transfusion is stressful for the baby. It's stressful for the doctor that's doing it. Let's make sure that the baby gets breastfed before the baby goes for the exchange transfusion, and then immediately afterwards. It's like any sort of procedure that's done on the baby, or sort of test that's done for the baby. For example, a chest x-ray for some reason. Why should the baby be off the breast? There shouldn't be any reason.
Okay.
There's another question. How to wake jaundiced baby up who is always asleep? Tried everything.
Well, again, why do babies tend to fall asleep at the breast? It's not because of the bilirubin, it's because they're not breastfeeding well. So babies who don't breastfeed well usually get sleepy. They sleep at the breast, they come off the breast, and they sleep. Or the opposite is that they're always crying. So once again, it comes back to, let's make sure the babies are breastfeeding well. The problem is that a lot of our procedures and things that we do during labor and birth make for sleepy babies. People think that, oh, epidural, that's wonderful. It doesn't do anything. No, it does. It does. The drugs do get into the baby. The drugs that put the mother to take away the mother's pain, the drugs do get into the milk and into the baby. So having worked in Africa, where very, very few women ever got anything during labor and birth, and I won't argue with people who say, no, I want fine, but you know that there are side effects. And, you see the difference. I saw the difference. Babies were born after labor and birth, and they came out and they're, where's the breast? I want the breast right now. Where is it? I want it. And they'll crawl up to the breast and they'll latch on all by themselves. And when you see babies born after epidurals, many of them are floppy and sleepy. And that's because they get some of the drugs that are used in the epidural. And I think that we mothers need to get informed about what causes these problems. We see, for example, all the intravenous fluids that mothers get during labor and birth, for example. Some of that goes to the baby. So the babies are overhydrated. They're not interested in breastfeeding because they're overhydrated. If they try to latch on, the mother's breasts are swollen, and so the babies can't latch on. So there's a lot that comes from the labor and birth that result in babies not breastfeeding well, that are sleepy and so forth, and they don't want to take the breast or can't take the breast because the breasts are so swollen. And I think you see this when mothers are in the first day or two after birth, how swollen their breasts are. And so it's difficult to get the baby latched on. I think that more and more mothers should at least get the information that IV fluids and epidurals. Epidural requires an IV because sometimes the epidural causes a drop in the blood pressure. So you get all this fluid the mother gets. They should restrain themselves on how much fluid the mother gets. But anyway, that becomes more and more complicated and is out of the realm now of jaundice alone. But nevertheless, if the baby doesn't feed well, the baby often will get jaundice.
I think this is also related to one of the questions that our counselors also ask. How can hospitals help protect breastfeeding, especially exclusive breastfeeding, with regards to the management of jaundice, especially when it's neonatal jaundice and it's prolonged?
Okay, well, if we're talking about jaundice in the first week of life, then again, it's not to push epidurals, to give mothers the information to make an informed consent. If the epidural results in my baby coming out too sleepy or doesn't take the breast well, then I'll do without the epidural. I mean, for me as a man to say, oh, you shouldn't have an epidural, it's not my business. But I think that mothers should know that this is not without its complications, and a lot of the problems of breastfeeding and jaundice in the first week and first 2 weeks of life are due to poor feeding, due to a lot of the effects of our birthing practices in modern hospitals. For the jaundice that I call normal jaundice or breast milk jaundice, there's nothing that needs to be done. There's absolutely nothing needs to be done. You don't have to take your baby out into the sun in order for him to get irradiated. Breast milk jaundice is good for the baby. And I'm talking again about a baby who is otherwise well, who is gaining weight well, who is breastfeeding exclusively and just doing well and happens to be jaundice. Who cares? On the contrary, it's good for him.
So we were saying that sometimes even doctors themselves and even nurses, have a different perception of jaundice than what you have. So what is the best way for hospitals to encourage to educate the medical staff to be supportive in this sense?
Well, unfortunately, I think a lot of medical staff and nursing staff are uneducatable about breastfeeding. I think that there is a real huge problem about health professionals getting properly trained about breastfeeding. They learn nothing about breastfeeding in their medical schools or in their nursing schools. All they may learn is that, breastfeeding is good. Or even worse, breast milk is good. Because particularly in the United States, they don't make a differentiation really between breastfeeding and breast milk, because so many women return to work so early in the United States. It's an appalling situation. And I think in Singapore, it's not that much better. How long is your maternity leave in Singapore?
4 months.
4 months, too short. I mean, anything less than 6 months is too short, because at least at 6 months, the babies can eat when their mothers are not around. They can drink from a cup. They don't have to drink from bottles. But in Canada, women can take up to 18 months of maternity leave.
Oh, that's great.
And it's paid poorly, but it's paid. It's paid from the money they've saved up in their unemployment insurance, but it's their own money, actually.
Wow. I think that's something that we are actually also working towards, to have a longer maternity leave and that kind of thing.
Oh, I hope so. Yeah, it would make
Which
all
is
the
left.
difference in the world.
Yeah. Okay. So there's one question about maternal food intake and jaundice. Again, some moms think that it's because of something that they ate. Like, for example, in Asia, we have this confinement practice where you eat certain herbs, and some people say that because of these herbs, that's why the bilirubin in babies are increased. So can you say anything about it? Like, do you have any comments?
I don't. Well, yeah, I always have comments, but well, again, if the baby is breastfeeding well, is obviously healthy, is gaining, is looks great, well, all right. Well, maybe these herbs are good for the jaundice. I just think it's something you see more in East Asian families. Anything but Caucasians. Caucasians have the lowest levels of bilirubin all around than babies of Chinese origin, Indian origin, anything like that. But we have to remember, baby is well, the baby is gaining well, the baby is happy. Obviously, as we say in French, il est en train de péter de santé. That means farting of good health. I don't know.
Wow. I think that's a lot for us to bring this kind of awareness to our mothers and our fathers and even our nurses and doctors in Singapore.
Maybe the last thing to remind them of is that the body does not have to make bilirubin. And if the body is making bilirubin, there has to be a reason why. Bodies don't do things for nothing. They don't waste energy to make bilirubin just because doctors can, treat babies with jaundice. So we have to remember that, particularly with the breast milk jaundice, or what I call normal, and remember what the real problem is in those first few days is almost always that the baby is not breastfeeding well if it's higher than the average level of bilirubin.
Thank you so much.
Thank you so much for
Thank you.
giving us your time.
Okay, thank you.
Yep, I hope to see you again.